you have to score really high marks.
Even someone commented, you saw that?
Yeah,
Someone kept a thumbnail with the timestamp.
With the
Yeah,
timestamp.
34 minutes.
This was the best part of the video.
I think he paid for that.
Hi guys, so welcome back to episode 2 of ScrubOut. I think we have someone new this time.
Oh.
Hi. I think they all already know that.
No. You are surprised.
Oh, really?
So why didn't you turn up last time?
I was stuck at the expo with my mom and I couldn't leave her alone, so I couldn't make it. But we're here today.
I had to speak for you too.
Yeah, I saw all that.
I think we 4 boys had fun last time. So how did you feel? You weren't here last time.
Yeah.
So what is your thought? Like how do you feel from outside as a third person? Seeing us 4 talk about dentistry, how did you feel?
It was great actually.
Really?
You guys really did well. Yeah, I didn't expect we would get such overwhelming responses from everyone.
that's
All
true.
of I think all our juniors, like so many people from the internet, so many of our staffs, everybody was so happy and so cheerful that we did something like this. So we got a bunch of messages, I think all of us got. So we will be replying to all of those questions in the end of the video. But I think you guys could have spoken about your courses in detail a little bit more. Like it was very general. I think most
That's
of them
what-
want to know what each of your courses are about, like what you get to do in Prosto, what quota you have in surgery, and how is it different from, how is Prosto different from MS Implant? Like what is the difference in quota between the courses and all that. So I think in that video we'll talk in a little more detail so that people actually learn something from it. So I know that you did FDS Prosto with your MS Implant, right?
Yes.
So why did you pick FDS and how did you club that? That'd be informative.
I think you are the first one to do it. Am I
Yeah.
right?
Yeah.
So initially I wanted to do MDS Prosthodontics, but only in Savita. I didn't want to go out and do Prosto. The main reason is that you get a lot of exposure in Savita.
That's true.
And being an undergrad here, surviving outside is very tough.
Yeah.
That's a reason. And yes, the next alternative was MS Implant. But I had 6 months duration, 6 months of gap in between.
After your UG.
After my UG.
Okay.
So I thought, why not take fellowship Prosto, which gives you a lot of crowns, bridges. You can even do FMRs in that.
Oh, in your
Yeah.
Okay.
So I overlapped my fellowship course, that is the FDS Prosto, which is a 1-year course, along with my MS, which is 2.5 years. Combined it for 3 years, similar to MDS Prosto.
Okay.
Yeah. So in my MS Implant, I get to do 2.5 years course. I get to do 60 implants and 120 crowns, which includes all your full mouths, ridge splits, sinus
Like all
lifts,
kind of implant.
all kinds of cases.
And when you learn Prosto along with implant, it's more easier
It's
to
more
plan
easier to
your-
plan my full mouths, like the prep and the implant combined.
As you did your FDS before, prior to this.
Yeah.
implant,
Yeah.
This course was similar to something what MDS Prosto does.
Yeah.
So it's like a
You does
cheat
both
code.
of
It's like a cheat code. It's a cheat code.
Yeah,
code,
okay.
yeah.
Yeah.
You've just started. It's been 6 months, 7 months.
It's been 6-7 months, not
6-7 months,
yeah.
Bro
yeah.
has been a research scholar all these
Yeah,
So,
for the last 7 months I was a research scholar.
Yeah, so he told us about the clinical aspects and quota and all that stuff about MS Implant. So can you tell us what theory is there or what do you do for the first
Few months was fully of research based stuffs. So we'll pick a topic for my thesis. We'll discuss with our mentors. Then we'll go to the HOD sir. We'll discuss and confirm the topics. Then we'll have a discussion with the tag committee where we'll be confirming with the thesis topic. And later on, after confirming this, we'll go to the SRB meeting where we'll have to defend why we chose that topic. And they'll
You'll
be
have
having,
to get like an approval before you start the thesis.
They'll be giving so many suggestions
Yeah.
how to make it better, all
Yeah.
that. So they,
I
they are
think-
like the top 2. We have the top 2 percentage of scientists in the world in our college.
Yeah.
So
And I feel like, you both are doing MDS and all the three
Hmm.
of us are doing MS. But I think almost we have the same
the
research
curriculum
quota.
is
True,
like
true.
it's
The
almost
research
the
is
same.
same.
research
Almost, yeah.
curriculum is the
yeah,
same.
so
for-
I have even 10 short studies to do in my course.
Including one thesis.
Yeah, including one thesis
Yeah.
and 2 patents.
Two patents.
So
The research
I think
part
we're
is the
all
same.
on
I
the
think it's
same
the
page
Research is the
as
same.
far as that's concerned.
You had a lot of assisting to do, right? All these
Yeah,
Australian.
that's
Yeah,
what-
yeah.
I
Actually,
forgot.
officially 2 patents, but how much you want you can do.
You
Yeah,
can do.
that's true.
Yeah.
In our department, the record for the patents it's 53.
Yeah, I know.
By a single
Dr. Lakshay has
postgraduate.
done 53 patents.
Yeah, I
Oh
see.
my god.
That's something can
We
never
have
imagine of that.
other record holders in the room, but we'll come to all that in the
Yeah,
coming
we have a lot of
episodes. Yeah.
record holders here.
Yeah,
a
so-
lot of
And-
achievers.
And talking about the research part, as I told, I had 10 short studies to do.
Yeah.
I mean, I have 10 short studies to
Yeah.
do in my course. We can choose whatever we want, and I guess we can do a PhD if you are interested. We can do a PhD with our
After
course,
your
right?
PG,
Yeah,
you
you
can,
can-
take forward your
Yeah,
thesis
thesis,
and
yeah.
convert into a PhD.
That is a great opportunity, I guess.
Yeah.
That one you don't get in every
Yeah,
college,
yeah,
any
so
other
that's
college.
something very.
No, because we get to do so many short studies and a thesis, you can club that all together and present
Yeah.
it for your, like an extended version of
That's
that
true.
as your PhD viva.
And talking about the courses, what he mentioned, we had there are multiple courses happening in our college, which are conducted by private institutes from Australia and New
institutions,
Zealand.
Australia and
so
New Zealand, yeah.
in the first 6 months, what actually helped us in molding our implant planning and all is that we got to assist these people who are coming from Australia and New Zealand. We could assist them in their planning or let it be their treatments. So in that we learned a lot actually. As a student who is new to an implant, they get to know all the aspects what is behind the scenes of that treatment, right? So
You got to
I mean-
assist full modes. That's
Yeah.
that's a really great thing.
We had
With-
Neodent program,
Yeah,
which is
Neo
a
Arch
Neo Arch,
program.
yeah, Neo Arch, yeah.
Just
That's a really great-
getting to be able to see everything before you actually do it on a patient
That's
itself is a huge
Exactly.
thing.
Not everyone gets that opportunity.
Yeah, like you have a clear idea. So talking about your department, Sanjit, I see like amazing work at the audit. Like everybody presents such good cases, beautiful photographs. So like, what is your quota? Like how many FMRs do you get to do? And like, how is Prosto at Savita? Is it hectic or is it fun?
I think it's a mix of both. It depends on how you take it, how well you enjoy the work, and how well you like to, explore different kind of treatments. Our minimum quota is like you get to do 30 FMRs, 30 full mouth rehabs, where other college students with whom I spoke to in any other conference, they tell that they have done like 3 or 4 in their whole 3 years of PhD.
is that 30 a limit or?
30 is the
30 is the
minimum you
minimum.
should be doing.
Okay.
And,
To
and
go out of
there
the
are record
college.
holders in that also.
Exactly. So 30 is the minimum. Our seniors, the great seniors, they have done 44 FMRs. That was the world record at that time. Now the newest world record is 53 FMRs.
Wow.
From the same college, there are 2
He's-
records.
they're
In,
both
in, in due course of 3 years, you're
3
saying.
years. They have done 53 and 44 FMRs. So this is only FMRs. Then you get to do around 30 is your base implant quota, and people do more, and then you can share your implants, your full mouths and all. You need not place all implants. You can share with perio, you can share with surgery, you can share with implant people, and you get to place every implant, whatever is available in the market. There is no, you only place this brand of implant. In UG, I placed around 6 different brands of implants, and now we are placing 3-4 different brands of implants.
New other brands,
we
yeah.
never did in UG.
UG.
And the beauty of Prosto or any other department in our colleges, be it Prosto. So if I'm doing a prep, I expose the teeth, the pulp gets exposed. I can do my own RCT. I can do my own cast post. No one says no to anything. Even
that's
today,
true.
I did an extraction. Can you imagine a Prosto PG doing an extraction? No one even says anything. They even, they encourage you to do, because once I refer a patient to other department, the patient is not in my hands. It depends on how fast Ashwin will send the patient back.
Yeah, and it's not
Over a
even like
surgeon.
you have to give it to that department because they need cases.
Exactly.
That
There's
too,
like-
they are lacking their quota. Or,
Yeah, it's nothing like that.
Exactly.
Everybody's everywhere. It's the cases are overflowing, so it's like you can do
So-
all that you can.
I get to do gingivectomies, gingivoplasties, and also crown lengthenings. So there is no.
I guess they will be more than the other departments will be. PG students will be more than happy that you do
Exactly.
it yourself.
Yeah.
You
No,
go
no.
to a perio PG
Same
and
fact,
say,
even we get to do what all he
That's
does.
what I'm saying.
Same. MS implant gets to do
what
everything.
I'm saying is, if he's doing a cast post or a RCT himself for his prep or something, the endo PGs will be happy for that.
Endo PGs
Yeah,
will be
they're
happy.
like one
they're already
less,
filled with cases,
one
right?
less OP today.
Yeah, I'm happy that he's
Yeah.
not sending any cases.
That's
because
what-
we already have more than 150
Yeah.
patients waiting every
That's
day.
what-
So that is a part of it, and there are many other things which you. There are very many student exchange programs you get to go. Many conferences, national, international. For international, I've been to the US for IADR. Department is very supportive. Our HOD sir, and they allow us to go to any conference. I've been to the IADR in the US. So these are the perks that you get in Prosto in my college, our college.
Let it be any
No,
department. like,
even in my department, they push us to go for conferences.
That's
like
what.
in the sense, every day there's a message saying register, perio coming up, endo coming up. So it's like they keep pushing us to do
be it
more.
national or
than-
international, they really
Yeah.
encourage us.
Because there is a like every day, let it be any senior dentist in the outside the college too. Dentistry is non-ending
Ever
process.
learning,
Ever learning.
ever
Yeah.
evolving.
Yeah, so
Every day we learn,
every
every
day
day
something new is
we
coming
evolve,
up.
yeah.
We can't actually be like, I'm all done with the studies part, or
No,
I'm
and
all
to
done
even do this podcast, all our staffs, not even one person were like, why are you doing this? Go study instead.
Yeah.
Everyone is
Exactly.
supportive.
That's
They're
true.
like, do as much as you can.
And
Keep-
you know, we have these innovative awards at the insignia where they give us best social media person, best innovative award,
Yeah.
and we
That's
have
true.
to have our own website, which is very mandatory being in our college. So all this, what we are doing, our college, like
I don't know if any other college is supporting the social media platform, or I don't know.
And most of the college, most of my friends who do very good work in other colleges, they don't post it because the college says that the intellectual property of the college. So
yeah.
we don't have any barrier
Restriction
in that
on that,
way.
yeah.
So we are very grateful for what we are doing, and it's also helpful for our own career at the end of the day.
That's true.
Coming to Ashwin, I think we've all heard a lot about your surgery.
Even someone
stories.
commented, you saw that?
Yeah,
Someone
I saw
kept a
that.
thumbnail with the
With the
timestamp.
time.
34 minutes.
This was the best part of the video.
I think he paid for that.
I was like,
Just
stop it now.
Yeah, so we got to know like most of how your day goes.
Yeah.
But like as a surgeon, the feeling of a surgeon is something completely different, right? So how did you feel when you did your first like major surgery case? What were the thoughts and how was it for you?
For my first case, I was very nervous before entering the operation theatre. I had to do many backup work behind the case. Then as soon as I entered the OT, I was little scared before starting the procedure. But a surgeon should always be confident, even though they do some mistake in the operation theatre. They should have a backup about what they're going to do next. So if a surgeon gets panicked in the operation theatre, it's not only about them, it's the patient's life.
So there should always be a plan
they
B.
should always be they should always have a plan B, and they should always be very confident in what they're doing. Even if they're doing some blunders in the operation theatre, they should be very confident in whatever they're doing.
Yeah.
That's what I feel.
That's nice. Beautifully said.
So all of us have told us about our work. So now let's come to Dr. Trisha, the VIP.
Actually, I myself explained a lot about her course in the last episode
Yeah.
because I had to cover up for her. I mean,
Yeah,
I
you
was a
sound
filler.
praising your course, so it's
No,
time
but
for
it's
you to
such
speak
a
about.
great course
I
actually.
know.
So like all of you said last time, MS Restorative Dentistry is the course that I'm doing. It's a PG degree at Savita Dental College. So it kind of it's a comprehensive course that bridges 3 huge departments together, which is endodontics, prosthodontics, and periodontics. So basically, I get to do most of what you all get to do. A little bit of implant.
Oh.
I also learn FMRs. I can do everything that's there in endo, everything that's there in perio. And yeah, I also...
Now it's like a 1v4.
And I also get to learn aesthetics. So I'm really happy that I can do all of this in the same place.
So
And,
what an aesthetic? Like what do you do?
Everything.
Everything.
Smile design and
Smile
specifically,
designing,
yeah.
laminates, veneers,
Oh, that's great.
composites, pink aesthetics, white aesthetics,
Bleaching, all those stuff.
bleaching,
Oh.
depigmentation, all of that.
That's great.
Crown lengthening, all of it. Anything that you would learn in each of these separately, it's
And
kind of
moreover, when you're
covered.
doing an FMR, I guess you can do like if it's needed to be an endo, go for
if
an endo
there's
first.
it- like Sanjit said, if it gets exposed or something, I can do the RCT. So yeah, basically you learn a lot of comprehensive treatment planning and like comprehensive like skill enhancement. So your diagnosis and like how you plan each case is very important. So in this course, you get to learn in-depth of perio, endo and prosto. So when I'm planning an FMR, I can also like, it's not just the white part, right? So you will like get to learn about the gums and
The red part.
Even the pink
part.
aesthetics.
Yeah, even the pink aesthetics.
But since you're doing all three, four, five departments, which is your favorite out of it?
Aesthetics. Yeah.
She is fully into aesthetics.
Ah, bro, you don't have to see blood in that.
Yeah, that's the reason why I didn't pick MS Implant also.
Okay. What about your course duration? Like,
It's a 3-year course.
Okay.
Just like you guys.
So is it like for one branch for 1 year?
It's a cycle. It happens in modules. So like it's 3 months of perio followed by 3 months of endo followed by 3 months of prosto and then 3 months of aesthetics.
But
and
then
3
it's
months
done,
of
right?
Implant.
Like
It's just I'm just talking about 3 months.
in 3 months, the whole perio module will be over?
No, for first year it's 3 modules.
Is it like a preclinical? No.
No, like initially, like 2-3 months we have preclinicals along with the research module.
Okay.
So, wherein we learn how to frame a research, how to publish a paper.
Yeah, we all had that.
Yeah,
I
we
guess.
all had that
Yeah,
together. So, basically, you learn all that along with preclinicals in all 3 subjects. So, once that's done, you move on to your first module, which is perio.
Okay.
And then once I'm up, see, the thing is, when my perio module is going on, I can still do FMRs and endo cases, but like the theory part is just that 3 modules. So 3 months I learn perio and then 3 months endo, 3 months
That
prosto,
makes sense,
3
actually.
months.
So that's the
aesthetics.
theory part. Okay.
But yeah, cases we keep doing throughout.
Like any case you can do at any time.
Yeah.
Okay.
I can do
That's really nice.
pretty much everything except surgery and ortho, I guess.
So I
just
guess
say, just
her
say you
course
want to
is-
remote teach, no? Or you did remote teach. You can cover his department.
No, actually she
the
can't
thing
do
is-
the extractions, right?
I'm not
Yeah.
actually, but I studied in Savita also.
That's right. I'm talking about your department. Oh my god.
No, I can go to surgery and I can do it.
Really?
Yeah.
Actually, it's on the same flow, no?
Yeah. No. I
No,
mean,
but it's not about like that.
No,
Like
I can't
any
send
department,
treatment,
if
I
they
can't
want to
send
go
treatment.
to
That's
other
true,
department
that's
and
true.
work, people you can
Yeah,
do. You can
they
do.
don't have a quota. That's what I was
Yeah.
going to tell.
No,
Yeah,
I
yeah.
can't send dias basically.
Maybe
like I
you
cannot
can
go and send dias
Come to
a-
my
By the way,
department and
yeah.
do the
These people
extraction.
won't know what dias is. Someone please tell them.
So DIAS is the dental archiving system where we have all the patient records, our own personal profile when a patient gets assigned to us. So once a patient enters today, the patient details are there forever. So a patient who's 20 year, who came to the college 10 years ago, all his OPGs, his CVCTs, his intraoral pictures, everything is there in the DIAS. So it's very easy. It's no paperwork, no going searching for all the patient records. You know, it's very simplified.
Even if
and-
the patient comes after like 3-4 years also.
Anybody can
like,
take
it
it.
will be 10 years.
Anybody can take
Exactly.
it.
The patient whom I treated on the first day of UG has turned up the
Yeah.
other day. So
Yeah.
I could see my own work there, what I did, what
Yeah, that's
One blunder.
So we got a lot of questions, and from whatever we've gotten, all of our DMs, I've compiled a few questions.
Is it like specific to a guy or like is it a general question?
No, it's like
Anyone can answer, right?
A dentist can answer.
a dentist can. This is
Oh.
Scrub Up the Dental Podcast. Basically, everybody, most of them want to know, how do you get into Savita?
So you basically, there are 2 types, like UG and PG. So you clear your NEET and you apply through your medical counseling and you get through your counseling, and you have to score really high marks
For a dental college.
For a dental college, and Savita being the number one.
Just
You
don't
need
think it's a
really
private
high
college and you
marks.
can get into
Yeah.
the college with
Yeah.
like an average score, I guess.
So after UG, you can come back as a FDS. You can take a MS course. You can take a ADS course, or you can. There are like many fellowship courses which you can see in the portal. And then if you're into research, there are many other opportunities which you can get in Savita.
But to be specific, like what is the course duration of each? I heard ADS was 3 months. The rest of the courses?
See, FDS is for 1 year. If it's a FDS ortho, it's for 2 years.
2 years.
MS, it starts from 2.5 for implantology. For restorative, as for Trisha, it's like 3 years. And there is this extended
Surgery internship that you
Yeah.
can do for any amount, like you can decide how long you want to do it.
No,
So if
that
you
is
want-
around 1 year.
I think it's just the quota.
Quota.
Like you have to
It is
complete these many.
FDS in minor oral surgery. That is for 1 year.
1
You can
year.
take up how much of the cases
So you get
want
to
and
do
you can
basically
do.
you get to do the wisdom tooth extraction.
You will be able to do alveoloplasties, multiple
Okay.
impactions. You'll be able to assist
GA.
PGs in general anesthesia
Okay.
cases. You'll be able to do sedation cases.
And I think in all these courses are like full-time courses. You can work from 8 to 3, but there is a, I think endo. If I'm not wrong,
Yeah,
endo
no, basically it
endo
is,
has
yeah.
two shifts. That is
There's
you
2 batches
alternate
in the
to-
same year.
They had to make 2 batches because the number of people who are
People
coming
are not-
in,
yeah,
the
it's
intake
not
is too
enough.
high. Endo has a morning batch and
Morning
then
batch
an evening
and
Bro,
batch.
literally
and
they get
even
2
general dentistry has,
Yeah.
even
Yeah.
GD has, and also in endo there's a new course for only microscopic endo.
Yeah.
So that is something fascinating. Not you won't get it everywhere. Not even in other colleges. There's no any course like that. You get to pay for other countries
Yeah.
to go and work there.
Yeah, private institutions doing that.
Yeah.
Like, not like colleges. The private, what you say, even IDA Mumbai and all is having courses like that. But for the, I don't think any other.
It's not as
institution-
long for 6 months and all.
Yeah.
Yeah.
So every case you do it under microscope.
Yeah.
So that's something.
I don't think in the FDS they get to do in the microscope. But
no,
yeah.
not yet.
Yeah.
Not yet.
And yeah, but like as the question was, how do you get into all of these courses? We've told them what all courses are available. So like, if you want to get into any of these, you should just directly go through the online admissions portal. So there's
And
no other
maybe
way.
after doing MDS in other colleges in oral and maxillofacial surgery, you can come back to Savita for super specialities like
Yeah.
cleft and craniofacial,
Yeah.
orthognathic
Onco.
surgeries, onco surgeries, and trauma. We have many fellowships, super specialty courses, and the duration for that will be around 1 year.
From now on, I don't think we'll get as many texts as we used
Yeah,
to
how-
get for the.
Just blunt, how do you get in? How do you get in text?
Like if you search in our chat box, like if you search admission or how to get in, like you will get hundreds of messages in the chat box. I
Not
guess.
thousands.
Yeah. Like all together, I'm saying, not like for just one guy. Yeah.
So yeah, we still have a lot more questions left, but we also have a lot of videos coming up. So we'll save the questions for later. And
I think we have answered a lot of questions for episode 2.
Yeah.
Stay tuned for episode 3. As she said, we have many questions coming up, and also there are many insider questions which we also have. We want to answer ourselves. So
and many more guests to come.
Coming
many more guests to come.
More
Very
exciting
interesting
stuff.
guests to come.
I really don't know who these guests are.
Very
No, we just
very
made that up. We
familiar
just made that
faces,
up.
very familiar faces in dentistry, and more importantly in Insta dentistry. So we'll be keep updating you. So we'll see you in the next episode.
So it is us scrubbing
Signing
out.
off.
Yeah, bye bye.
Bye.
See you.